Hello there, dear viewer, and welcome to Health Nuggets Live. This evening, we are looking at cervical cancer. Definitely January being Cervical Cancer Awareness Month. We thought it wise just to kick off or just start the Health Nuggets show by creating awareness about cervical cancer. Remember, as I had already mentioned, January is Cervical Cancer Awareness Month, and probably just to let you know of how the numbers look like, that is in Kenya. Probably if we can just get that particular board on issues to do with cervical cancer in Kenya. As you can see right there, cervical cancer is the second most common cancer in Kenya. That is definitely after breast cancer, that is among women. And just looking at the number of women that die daily, number of women that die every day as a result of cervical cancer, those are 9 women dying every day from cervical cancer. And now cervical cancer mostly affects women between the ages of 35 to 49 years. And just looking at on issues to do with screening as well as vaccination, screening is recommended for all women aged 25 to 49 and vaccination for girls aged 9 to 14. So those are just some of the statistics as far as cervical cancer is concerned right here in Kenya. Remember, cervical cancer not only affects Kenya, but it's actually a global or a public health concern that is globally. So that's the topic of discussion that you're going to focus upon this particular night as we continue creating awareness about cervical cancer. And the World Health Organization is just focusing on 3 main areas. That is just you getting informed, you getting screened, and you getting vaccinated. That is definitely girls between the ages of 9 to 14. And in studio, I'm being joined by Dr. Aurora Maranga. He's just going to help us in understanding this particular subject even wider. As you can see on the table, we have some dummies, and they're just going to understand how exactly does cervical cancer screening occur. So, Daktari, karibu sana, and thank you for creating time this particular night.
Thank you.
I'll give you an opportunity to introduce yourself.
Thank you for welcoming me here to your studio. My name is Dr. Aurora Maranga, just like you have said.
Yeah.
I'm an obstetrician, gynecologist, and an oncologist from Kenyatta National Hospital and also Janice Hospital here in Nairobi.
And definitely I just have to commend you for the good work that you're doing, especially at Janice.
Thank you.
Especially in terms of cervical cancer, you actually have an event that is from 16th where you'll just be subsidizing prices for the cervical cancer screening, and we'll just be talking about that in a bit.
Yeah.
But just let us try and understand what cervical cancer is. I know that it's not a new term to many, but probably people just know of the term cervical cancer, but they just don't know probably how does it come about. Yeah.
Thank you. Cervical cancer is one, as you rightly said, is the second commonest cancer in women. And cervical cancer, as the name implies, is cancer which occurs at the cervix. Now one may ask, what is the cervix? Cervix anatomically is the entrance to the womb or to the uterus. If I may use the dummies, if you could focus kindly here. Which camera? That one?
This camera here. Yes.
So if you focus here, so we have the birth canal here. This from the outside. We have the birth canal here. Then we have the cervix around here. And then that's the entrance to the uterus or to the womb. Here we have the tubes and we have the ovaries. Yeah. So you're talking about this particular small organ. It's a small organ, but it causes a lot of havoc when it is when it has cancer. Now, cancer of the cervix. The cause for cancer of the cervix is a virus. It's a very tiny virus. It's called human papilloma virus. You earlier mentioned about the vaccination, and that is true. It is there's a vaccine which is available, and it's helping prevent cervical cancer. So human papilloma virus or HPV, there are various types. It is sexually transmitted. It's the commonest sexually transmitted organism, so to speak, globally. but very few actually tend to proceed on to get cervical cancer. Less than 5%, around 3% may be the ones who may progress to develop cervical cancer. Yeah.
And is HPV the only cause of cervical cancer, or are there any other causes apart from that?
It's actually the main cause. It's the main cause of cervical cancer, and that has been proven. The other things which come around, and those are the risk factors, so to speak, really the risk factors for acquisition of human papillomavirus. And here you're talking about sexual activities, you're talking about sexual behavior of individuals. So that's why when you talk of a high risk of multiple sexual partners, or having a partner with multiple sexual partners, or somebody who has many children, generally what we call high parity. Those are really, or somebody who has a sexually transmitted infection like gonorrhea or chlamydia or syphilis, or low immunity like in HIV or AIDS. All these are risk factors for acquisition of a sexually transmitted organism, which is HPV. So HPV is really central, and that is why when you talk about prevention, the vaccine comes in quite handy, because you are really preventing what is very central in causation of cervical cancer. Yep.
And probably for the other cancers, let's talk probably of breast cancer among other cancers. There is the genetic factor. Is it same for cervical cancer?
Not so directly, though. You may find that some people genetically they are a bit more predisposed to forming cancers. But human papilloma, for cervical cancer, human papillomavirus seems to be very central. So one may have that, may have the genetics for easily forming a type of cancer, but there has to be the virus, the HPV virus, for that to happen. Yep.
Okay, now before we look at the science, you've brought in the human papillomavirus. Let's just talk about it and how the vaccination helps, especially for these young girls, even as they grow up.
Yeah, for the vaccination, remember vaccination you're targeting a population which is not exposed. That's why we are talking about 9 to around 14. With the assumption that this is before their sexual debut, that before they start engaging in sexual activities, before they get exposed to human papillomavirus in the first place. And it's really the right time to do that, but basically anybody can actually be eligible for the vaccine. So long as they have not been exposed to the human papillomavirus, or at least they haven't had cervical cancer. So in that case, then many people actually do qualify for that. The reason why it is insisted on 9 to 14 sometimes is because from a public health perspective, you want to target a population where you'll get the most benefit to the society or to the community. But otherwise, even men and boys, if you look at other countries like New Zealand and Australia, they're actually vaccinating plus their boys. So they're targeting a scenario whereby a generation will come up without human papillomavirus and therefore without cervical cancer. One may add that human papillomavirus does not only cause cervical cancer, it does cause other types of cancers because it's sexually transmitted. Depending on sexual activities, one may get like penile cancers in men, although it is much lower as compared to cervical cancer, cancers, oropharyngeal, throat cancers and the like. Although these are to a less extent as compared to cervical cancer. And for those which I've mentioned, it's not all of them that actually emanate from HPV.
And now that you've brought in boys, so both of them are carriers of the HPV virus? Both boys and girls?
Yeah.
All right. So now let's shift gears again now to cervical cancer.
Yeah.
What are some of the signs that we are looking at? What are the telltale signs? And do they happen immediately or do they take time to show up?
That's a good question. And cervical cancer has no symptoms initially. And it's a good thing, but it's usually tragic because a patient may only come to the hospital when there are symptoms, and that is when it is late. When there are symptoms, it means it's a bit late. So in other words, one is looking at getting people screened when they have no symptoms. The best time for any woman to go for cervical cancer screening is when there are no symptoms at all. And making it like an annual event, at least every 1 or 2 or every 3 years, to have pap smears or to have cervical cancer screening. So coming back to the question, there are no symptoms per se. And it takes years before one develops cervical cancer from the time they're infected with HPV. It may take 7 years, 10 years, 20 years even. The good thing with human papillomavirus, in a way and in quotes, is it gives us time to actually recognize that it is in the body and it's causing damage before it eventually causes cancer. Eventually, when somebody has symptoms, that could include vaginal discharge, which turns out to be foul smelling, and it can be pretty foul smelling because it may get infected. Could have bleeding after maybe coitus, sexual activity, or after exerting, maybe carrying something heavy. So, and then later on, one may have low abdominal pains or back pains, and these symptoms tend to worsen as the disease progresses. So the take-home message really for our viewers is one doesn't need to wait for those signs. Yeah, just need to make a habit of going for annual checkups. But at the same time, if there are any of those signs, it's always good at the earliest opportunity to go to a hospital and see your doctor. Yeah.
And now for the bleeding, how do I differentiate, at least for the discharge you mentioned that it could be smelly, but for the bleeding, is it spotty or is it just like the menstrual blood, or how exactly do you differentiate?
Yeah, it could initially be just spotting, just irregular spotting, but at the same time we have to differentiate two things. Are we talking about an individual who is before menopause, before 50 years, or is it somebody post-menopause, past 50 years? For any bleeding occurring after menopause, that is abnormal and needs to be investigated. It could be cervical cancer, it could be uterine cancer, it may be anything else, but it is always a bad sign to bleed after menopause. And the earliest opportunity, somebody must really go to see their doctor. Before menopause, though, of course, one may be having regular periods, but at the same time may now start having abnormal bleeding. They have their usual periods, their usual cycles, but in between they're having spotting, they're having bleeding, which is really, which is not cyclical, which is not normal. So at that particular point, then they need to know this is unusual. I may also hasten that there are also contraceptives, though, which cause abnormal bleeding, like Depo-Provera. These are injections which are given every 3 months. That those implants, like Norplant, Jadel, which are used for family planning as implants, which also cause abnormal bleeding. There could be some types of coils, although that's not as common, which may cause abnormal spotting. So in other words, when in doubt, really, one has to visit the hospital to be seen and to be confirmed that it's okay. Yeah.
Okay, and now you brought in quite a topic that is to do with the infant, that is family planning and cervical cancer. Yeah. Other than these other ones, the pills and everything, just the coil, because it's inserted, could it lead to probably cervical cancer, or does it affect in any way?
No, it doesn't. No, the coils don't. Contraceptives, they're generally quite okay and they're quite safe. They don't really cause cancer as such. But there may be some association between the pill and cervical cancer. But at the same time, it's not really the pill which directly causes cervical cancer. No, there has to be, there has to be human papillomavirus in the background. So for somebody who's on the pill, it definitely also means that they are probably quite sexually active, isn't it? As compared maybe to somebody who's on a different type of contraceptive. So we don't want to demonize contraceptives and say contraceptives do cause cancer and they do cause cervical cancer. But obviously when somebody has cancer or other types of cancer like breast cancer, then we tend to leave out the hormonal contraceptives.
All right. And now just looking at the age, you've talked of menopause, and we've just looked at probably the age where many women are affected or just have cervical cancer is between 35 to 49 years. So definitely age is a factor. Yeah. So does this, or what's the factor now between this particular age? What causes it at this particular age?
You have to look at what point you're right that cervical cancer is more common between those ages, 35 to around 49 or thereabout. And it tends to occur much earlier actually for those who may be HIV infected or maybe in AIDS. But central to this is human papillomavirus. Human papillomavirus. For most people, they tend to acquire that at the age of around 20, between 20 and 27 or thereabout. And then their immunities tend to eliminate it from their system. But a few may have it persistent in their system, in their bodies. And then because of persistence of that infection, then the process of the cervix changing into cancer starts and continues. And it may take even up to 15 years. So take somebody who is infected at 25 years, at around 15 years, at around 10 years, then you get that age, 35 to around 50. Yeah.
All right. You wanted to add something?
All right, all right.
All right, so definitely just be looking at this screening. That's why we have this particular dummies right here. But I think we will be taking a very short break. Please just feel free to ask any question that you have as far as cervical cancer is concerned, or as far as anything that Daktari has mentioned in regards to cervical cancer. Remember, right here on Health Nuggets, we are just joining the world in creating awareness about cervical cancer, informing you on issues to do with screening, issues to do with vaccination, and just making sure that you are informed. Remember, the World Health Organization indicates that cervical cancer is 100% preventable, definitely if you go for the early cervical cancer screening. So we'll be taking quite a very short break. We'll be right back. That's with the practical bit of it as we look at cervical cancer screening. Don't go too far.
PCA Booth Girls High School of Excellence is an exemplary girls boarding school located in a calm environment perfect for learning in Ongata Rongai, Kajiado County. Our sole responsibility is to equip our students to competitively fit into the ever-growing world-class institutions and the job market. An all-rounded student is what pushes us to burn the midnight oil.
It is school of excellence in teaching and performance, but it should also be school of performance in all areas of construction, areas of repair, areas of stewardship. It should be a school of excellence. because we are taking that it is a school of excellence just for as far as performance is concerned. No, it should be a school of excellence in all aspects.
Seeing the uptake within which, the speed within which the community have embraced the school, there is no doubt that the demand will outstrip supply in the next few years to come.
Apart from academics, we have some co-curricular activities like we have handball, we have volleyball, we have the table tennis, and even we have the swimming pool whereby our girls are nurtured on how to swim. Indeed, PCA Ongata Both Girls High School is a place to be so that we can nurture the talent of your daughter.
We have spacious classrooms, well-equipped library, science and computer laboratories, dining hall, modern kitchen and dormitories. The fees is affordable.
I also studied as a parent to PCA Both Girls High School. And when I was sharing with the director of education, she told me there is a school less than 200 meters from your office. And I came, and I was convinced, and I brought her here. So I'm proud to be part of this community. I'm happy that indeed I can see a good school.
Bring your daughter to us so that we mold her in character, in the ways of God, and also we mold her in academics.
For more information, call the number 011-311-4284. You can also send an email to PCA Ongata Both Girls High School at gmail.com.
Here, we prepare food that is good for your body. And even better for your soul.
What is the resource that God has given you?
Is it time? Is it family?
Yeah.
What have I done with that resource?
Well, so welcome back to our Health Nuggets Live this Monday night, and thank you for each and every one of you who are watching. That is through Facebook, that is CAC TV Kenya, as well as YouTube CAC TV Kenya. Thank you so much for all your comments. I see quite a number of you are just acknowledging that the show is quite informative, and definitely will continue just informing you on issues to do with cervical cancer. In case you're just joining us, you're not too far off. Definitely you can always play back what we've just discussed, but I'm still with Dr. Aurora Maranga, who is just helping us understand about cervical cancer. And definitely, as I promised earlier on, we're going to look at that is the practical bit of it. But before that, Daktari, you were just sharing probably just to tell us how exactly is cervical cancer diagnosed.
Okay.
Yeah.
Yeah, there are two aspects to the question. One is screening, and screening is just like throwing a net in the ocean. You can get anything. You can get crabs, you get fish, you get types of fish and the like. So the screening bit is screening the society or the community at the community level. You may pick infection, you may pick cancer of the cervix, or you may pick infections which may lead to cervical cancer, including HPV. So for the screening, there are various types of screening. There is pap smear, which we are going to illustrate here. That's the commonest. It has been in use for many decades. We also have HPV. We have already talked about human papillomavirus and what actually causes. So it's possible also to screen for human papillomavirus itself. And then we do have other methods which don't use the same approach like pap smears, where a nurse or a doctor or a clinician can actually apply some reagent on the cervix, and then they're able to tell whether it is normal or abnormal. So from the screening bit, then one goes to how do you make the diagnosis, the actual diagnosis, how do you confirm the diagnosis. So what you're going to do here is basically just to give ourselves a glimpse to what really happens in the clinic. So generally one would have the gloves. It's always a clean procedure so that the patient doesn't get infections or a contamination from the clinics. And among the things which you need, of course, is a good lighting. And we do have this gadget here, which we call a speculum. A speculum is basically just to help us to visualize the cervix. So it would usually be put inside the birth canal, and then we are able to open. And by opening, then we are able to see the cervix from the other end. So apart from this particular gadget, obviously we would need a lubricant, like a KY jelly, for example. Then we lubricate, and then we are able to look at the cervix. Apart from that, this is what we call a pap smear kit. A pap smear kit has several things inside. It does have a brush. It does have a brush. Allow me to open this. At least for demonstration. It does have this kind of brush. It's actually a fine brush. And this is what we put on the cervix, and we rotate on the cervix to get cells from there. And those particular cells, so this well lubricated goes up to the cervix, and then this one goes to the cervix and gets cells from there. There's nowhere we are cutting the cervix. And then after that, there's a glass slide here. There's a glass slide here. So the cells which we have gotten from the cervix, we smear them there. And there's what you call a fixative. It's basically a liquid which we pour on top. Then we leave it to dry. And in the clinic, what we do is basically after that is done, we discard this. But the same one can be used to check for HPV. Yeah, so we can use this to check for HPV. And then we close it up and we send it to the pathologist. Yeah. Pathologist then will prepare it and then give us a report whether the cervix is normal or there's an abnormality. Now from that, if it does...
Just before you move on from here, because I know that probably many women do not go for the pap smear screening because of the fear, this particular gadget, the size of it. Now first, as you insert this particular gadget now into the cervix, do you, like when you're looking, you look with the naked eyes, or you use probably a microscope, or it's just the naked eyes?
At this particular point, it's just naked eye with a very good source of light. That is what happens. Where we use a microscope is the next step, which generally we call colposcope. That one is usually for abnormal pap smears. So if the report does come and it shows that a patient has abnormal pap smear, then we have to go now to the next step, which is we look at the cervix under microscope, we put reagents on the cervix, and then we take a biopsy. Biopsy is a representative tissue, which is taken under now microscope, which is sent to the lab, to the pathologist, now to tell us confirmation. Is it cervical cancer? Is it not? For the pap smear, it's not confirmatory. It just helps us give direction that probably we may be dealing with cervical cancer. And I must hasten to say that there are several stages that the cervix undergoes before it actually becomes actual cancer. And those, we call them pre-cancer stages, which are absolutely treatable and curable. Yes. Even cervical cancer is treatable. When you've got very early, it is curable.
Okay.
But there's treatment which we'll talk shortly.
Okay. Yeah. And now still on the gadget, what material is it made of? And when probably what's the feeling like? Is it painful or how exactly do you just, let me say, just to create awareness so that we are eradicating the fear, because many people will be like, this is something too big to just penetrate my cervix and things like that.
Yeah, this is how it appears. This is the area which we lubricate and goes through the birth canal. The rest of this bit is really, it's outside the body, and it helps us just to adjust so that we are able to see from this particular end. This is plastic. It's a great improvement from the previous ones, which, although I think we may still be having some in some facilities, which are metallic. So this is plastic. It's very, very friendly. It's usually well lubricated. And generally, it may be uncomfortable because it is an invasive type of examination, but generally, it should not be painful. And the many women who usually would come, they really fear this gadget from whatever they have been told before. And when we do assure them and we do the pap smear, they're like, I mean, it's not as bad as they had previously. And actually, I've never had any patient say that it is more painful than what they had previously. Yeah, so it's painless, really. It's painless. It's invasive, though. But it also depends on are there other confounding issues. In other words, this particular patient, is she having an infection in the first place? In which case, any examination will be uncomfortable. Is she having any infection causing maybe discharge, causing any itch? Causing discomfort in the first place. So obviously this one, you introduce it, it's gonna cause a bit of discomfort.
And what's the best time for a woman to probably just be screened?
Anytime when they're not having periods.
Their menses.
Period.
Okay.
Yeah.
Okay.
Previously it used to be said mid-cycle, but you see the timing bit, it was also found it's not really, we are closing out many patients and yet not having adequate benefit by specifying and saying mid-cycle. When a lady is probably on ovulation or such, it doesn't really matter, so long as they're not on their periods.
All right. Now you've talked about treatment. Many people actually, I don't think they know that cancer is treatable. Probably just the prevention and management bit of it. But let's look at the treatment as well as now the percentage of the chances. Yes.
Chances of?
Of like me being declared cervical cancer free. Yes, yes.
There are various types of treatment. One, we already talked about the pre-cancer stages. So when you're talking about cervical cancer, it's really a spectrum from stages which are not cancer, they're just pre-cancer stages. And then there are those now where you have actual, what we medically call invasive cancer. Now, for the pre-cancer stages, those are totally treatable. We basically would either remove the part of the cervix which has the changes, and a woman would still be able to retain her uterus and even go on to have children. So, but for those ones who have finished getting their children and they have no use, in quotes, for the uterus in terms of reproduction, then they do give consent and we may remove the whole uterus together, the whole cervix, especially if it's almost becoming cancerous. Now, for those ones where you find it's actually actual cancer, then it depends. There are stages of cancer. There's stage 1, stage 2, stage 3, up to stage 4. Stage 1 being the mildest and stage 4 being advanced. Now, there are 3 modalities for treatment, generally speaking. There is surgery, which can be done, especially if the cancer is early. And then we have radiotherapy, where we use radiation energy. And then there is chemotherapy. Chemotherapy are injections, basically injections which are mostly run into the veins, and then they target cancer cells in the body. So going back to the surgery, depending also on the age of the patient and such like, and other factors, and especially the stage, then we do what we medically call radical hysterectomy, where we remove the whole cervix, the whole uterus, and the nodes. So it's an extensive type of surgery. And in most cases, when it's done the right way for stage 1 disease, you should generally have, let me not say cure per se, but one goes into what medically we call remission. One goes, you can't detect any disease, and most of the time they may stay for as long, without the disease recurring. Radiotherapy is, as the name implies, we use radiation energy. One is put on, there's external radiation where we irradiate the area externally into the pelvic area. And that is done every day, 25 sessions, generally speaking. And the patient spends around 5 minutes each day being exposed to that external radiation. After that, we do use internal radiation, where we put some radioactive material inside the birth canal next to the cervix, and it basically radiates that particular area. So in other words, there are various modalities. It depends on the stage of the disease and other factors, but mostly the stage of the disease.
And now for just looking at the stages still, will the signs be the same?
No, they will not be the same. For stage 1 disease, they have very minimal signs and symptoms. In stage 1, you may actually not even be having any pains, probably what we earlier talked about, post-coital spotting, or spotting on exertion, or just having some mild pervaginal discharge. As one progresses from stage 1 to stage 2, stage 3, stage 4, then the symptoms get worse. Now one may have foul smelling, very foul smelling pervaginal discharge, a lot of unprovoked vaginal bleeding, maybe severe low abdominal pain, severe back pain. Now the symptoms become severer as you move up the stages.
Okay, and now after, let's talk of treatment. Let's say the treatment has been successful, and I'm now cervical cancer free. The chances of now it reoccurring, and what are some of the things that are probably, once you've been declared cervical cancer free, what are some of the things that you can do so that the cancer is not reoccurring again?
That's a good question in terms of recurrence. Now, recurrence depends on the stage, how early the disease has been caught. If it's been caught early in stage 1 and one gets aggressive treatment, good treatment, appropriate treatment early, then the chances of the cancer coming back is remote. But if you're talking about stage 3, stage 4, it's more of control of the cancer. You may not be able to completely eliminate it, or if you do, then it may recur. Chances are much higher to recur. So the earlier the stage, the more likely it is to be declared cancer-free.
All right, I think that answers it. And now that we've looked at, let me just say, the main objective of the show, as we had just put it, I'd like us to just try and look at issues to do with policy, even with cervical cancer. Just being one of the senior oncologists in the country, what steps will you say Kenya has made as far as just fighting cervical cancer? Because you already have women in the country that have cervical cancer. We've looked at the numbers, 9 women dying every day as a result of cervical cancer. I mean, these are not just numbers, these are actually human beings. So what steps has Kenya made, and what do you think the country can actually, what role can the government and even policymakers play just to try and even just reducing these numbers?
Okay. having been in practice for quite a number of years now, there's been a lot of changes and positive changes in terms of the screening, the diagnosis, the treatment of cancers in this country. We are far from where we probably would wish to be, but there have been tangible progress. Some of which is the vaccination, which you talked about. At least there's a government initiative on that to vaccinate 9 to 14 years. It's already being done in schools. And it's a program which has a lot of potential. And hopefully, as time goes by, we should be able to raise a generation which is HPV free and hopefully cervical cancer free. So that is one. Secondly, cervical cancer screening, whether you're talking about pap smear screening, there are other ways of screening for cervical cancer. Those ones are available in government hospitals and obviously private hospitals, and pretty subsidized. They never used to be that subsidized, and a lot of healthcare workers have actually been trained to screen and also later to, of course, to treat. And the other aspect is there's a lot of trainings which the government does offer to healthcare workers. The awareness like now, which you are doing as CAC TV and other TV stations and other media, social media and the like. That in itself, of course, is awareness. And then in terms of policy, there's a National Cancer Control, there's a program which is actually in place in terms of formulating policies, formulating protocols, some of which some of us are actually involved in terms of how do you screen for cervical cancer, how do you diagnose it, how do you treat it, how do you do referral to which center and cross-refer and such like. So there's actually a lot which is happening. And lastly but not least, there's been a lot of changes in terms of healthcare financing with NHIF, which we should actually applaud them that despite everything, cancer treatment, including cervical cancer, is one of those which have been well supported, because we are coming from a place where it was never supported before, or hardly tangibly supported, to now whereby at least NHIF does pay for most of the treatment.
Okay. Now, you just, we had mentioned earlier on that is over the subsidized price that Janice Hospital will be having, that is on 16th. I'll just give you an opportunity to do that. But before that, I just want us to look at HPV. Very briefly, there are so many myths around HPV. There are myths that are probably, if your daughter will be vaccinated, this and this will happen. Now, let us not look at the myths, but let's look at the facts of HPV vaccine being the main cause of cervical cancer. Just looking at the screen, if a parent has a 9 to 14-year-old girl who has not been vaccinated, maybe a word from you as an expert to them.
Okay. 2008, the person who actually discovered the link between HPV and cervical cancer was awarded the Nobel Prize. That was 2008. After that, the HPV vaccines were they came about, they are being used. So for the last, you could say, from 2008 up to now, several years really, that's when we had the first vaccinations. And they've been found to be quite effective, usually given 3 times, ideally, but 2 times could also occur. And that is from time 0, after 1 month, and also at 6 months. And they have been proven to work. There's no doubt in the scientific world that there's a relationship between those two. And in terms of efficacy, that they do work, we have seen it work. In terms of the side effects, like any other vaccine, any other injection. When you give an injection, there may be, pain, of course, there'll be pain after the injection itself where you have given it. But in terms of serious adverse effects, serious things which can cause serious side effects, it has not been proven. There could be incidental, coincidental, reported cases, but they are pretty safe. In terms of availability, it's very safe. Personally, I find I'm a pro-vaccine person. So even when the COVID vaccine came, among those who actually went for it because we do believe in it, there are those who may have a contrary opinion, obviously. My two daughters, Fiona and Zawadi, they've had the vaccine. So if I really didn't believe in it, do you think I would give my daughters?
No. Okay, and it's very effective just from how you're speaking. Yeah,
exactly. So it is something which I would really recommend parents to take their daughters. And apart from that, really, there are other things which can also prevent. Let's not say it's only the vaccine. There's also the moral issues in society. We are talking about chastity. Do we keep our girls, off the streets? How do we keep them engaged? Education is extremely important. How do we delay sexual debut? All these factors are there, and of course religion does come in. So let it not come out like we're only talking about I'm only talking about the vaccines and the screening. No, there are other things which must be looked at. Looking at promiscuity, how do we acquire this HPV in the first place? How can it be prevented? The use of condoms, for example, may not be 100% in terms of prevention of HPV, but at least it does prevent HIV, it does prevent other sexually transmitted infections. So it's a whole batch of approaches which are available to all of us, available to parents, available to our children, our girls and also our boys.
Okay, wonderful. Now talking of boys again, why is it that in Kenya there's no vaccination for the boys?
It's from a public health point of view, really. If you have a limited budget, you'll probably cut your cloth to suit you or to fit you. It's not like there's no benefit. There is, as I mentioned, New Zealand, Australia. They are vaccinating boys, and they are looking at 2030 as a time when they feel they may actually have eradicated HPV from the younger generation, so to speak. So for us is, if you vaccinate the girls, then you get more benefit than if you're to vaccinate the boys alone. But the best would be vaccinating both. But I guess we don't have that kind of resources.
All right, thank you so much for that. Now let me give you an opportunity very briefly just to tell us of what exactly will be happening at Janice and why did you decide to do that? Okay,
thank you. On 16th, because this is a month for cervical cancer screening, and as Janice Hospital, we usually would like to extend benefits to clients, to the community. So we'll be having free screening, actually. It's a free cervical cancer screening on the 16th, whereby whatever we have demonstrated here, we're going to do it, and we're going to do it for free for those who will be coming on the 16th. It's really because we believe very strongly as a facility and even as an individual that this is extremely preventable cancer, and it's not acceptable really for somebody to get cervical cancer when something can be done. So we encourage the listeners to send somebody, come yourselves, send your spouses, whoever in your circle to come and be screened. And if Janice Hospital is far from you, go to the nearest hospital, nearest facility. The basic message is get screened. Yeah.
And actually during this time of the year or just time of the month, many hospitals either subsidize their prices or do a free cervical cancer screening as you're doing. Now, your location.
We are, Janice Hospital is located near Mbagathi Hospital off Raila Odinga Road. Inside Sunview Estate. Sunview Estate is just opposite Kenyatta Market. Yeah.
All right. Thank you so much.
It's a level 4 hospital, so it's a large facility.
I've been there and I can definitely attest to that. So thank you so much for creating time. Thank you for informing us. I've seen quite huge numbers. Just trying to learn from this. Many of them are saying that this is quite informative. And the fact that we do not have questions, it means that you've just taken us through very well, and we are very grateful for that, for spending your time and just coming in the studio at this particular time of the night. So thank you so much for tuning in. Once again, if you're just joining us, remember you can always go to our social media pages, that is KAK TV Kenya on Facebook and YouTube, and you'll definitely find this particular discussion. Remember, we were looking at cervical cancer, just focusing on the causes, signs, as well as prevention in terms of a treatment, well put by Dr. Aurora Maranga right there. Remember, January being Cervical Cancer Awareness Month. As you may know, right here on Health Nuggets, we'll be having consecutive shows like this. We'll bring in cervical cancer survivors just to share the story in order to motivate you who is at home, either who is a cervical cancer survivor or someone probably that is just fearful of the cervical cancer screening. Remember, the main aim is to inform you and just try and create awareness about cervical cancer screening, as well as that is the HPV vaccination for girls between the ages of 9 to 14. So once again, thank you so much for tuning in. That was Dr. Aurora Maranga, who is an oncologist as well as a gynecologist right there. So we are wishing you a blessed night. My name is Aida Muzati, and as always, your health matters.